Mitochondrial encephalomyopathy, lactic acidosis, and stroke-like episodes, commonly known as Melas, is a rare genetic disorder caused by mutations in mitochondrial DNA. These mutations impair the mitochondria's ability to produce energy. When this happens, cells are unable to get the energy they need to work properly, which can impact multiple organ systems throughout the body, particularly the nervous system and muscles. The brain areas most affected by Melas are the cerebellum, cerebral cortex, basal ganglia, and thalamus, with initial lesions often developing in the parietal or occipital lobes. While it is a rare disease, Melas is considered to be one of the most common mitochondrial diseases. Some estimates suggest the prevalence to be 1 to 16 in 100,000 people, and others suggest it could be as high as 1 in 4,000 individuals. Men and women are equally affected by the condition. Symptoms typically appear during childhood, usually between the ages of 2 and 15, although onset can occur earlier or later in life. The average age of death is between 19 and 35.4 years old. Diagnosing Melas is challenging because patients can present with variable symptoms. Clinicians rely on a combination of serum tests, muscle biopsies, genetic testing, and clinical evaluation for diagnosis. These tests help practitioners look for specific biomarkers associated with Melas. These key biomarkers include elevated lactate in the arteries and cerebrospinal fluid. This is detected through blood tests or lumbar punctures. Ragged red fibers in muscle biopsies, which form when mitochondria multiply and cluster together to compensate for poor energy production. These fibers have a bright red and irregular appearance. Several genetic mutations have also been linked to Melas. The most common mutation observed in Melas patients is an adenine to guanine substitution on nucleotide 3243 in the MountTL1 gene. This mutation causes errors in mitochondrial protein synthesis and disrupts the electron transport chain, leading to reduced ATP production and widespread cellular energy failure. Neurological, muscular, and psychological function can become disrupted by Melas. The three hallmark neurological symptoms are encephalopathy, lactic acidosis, and stroke-like episodes. Encephalopathy may cause confusion, reduced awareness, and memory loss. Lactic acidosis results from reliance on anaerobic metabolism because aerobic metabolism is disrupted. This leads to muscle weakness, nausea, and vomiting. Stroke-like episodes often present as weakness, paralysis, or numbness on one side of the body. Other neurological symptoms include seizures, headaches or migraines, dementia, developmental delays, and nerve damage, which causes pain, numbness, or tingling sensations in the hands or feet. Muscular symptoms often involve muscle weakness and low muscle tone. Psychological symptoms may include depression, anxiety, personality changes, and attention difficulties. Melas can also cause short stature, progressive hearing loss, heart problems, such as arrhythmias, difficulty breathing, diabetes and other hormone problems, gastrointestinal or kidney issues, skin rashes, and anemia. There is currently no cure for Melas, so treatment focuses on managing symptoms and improving quality of life. Common interventions include physical therapy to help aid muscle weakness, hearing aids for those who experience hearing loss as a symptom, and anti-seizure medications. More recently, supplements such as L-arginine and L-citrulline have shown promise in managing more severe symptoms, particularly stroke-like episodes. Arginine and citrulline are nitric oxide precursors. Because Melas is associated with nitric oxide deficiency, supplementing these amino acids helps to restore nitric oxide levels, improving blood flow and reducing brain damage during stroke-like episodes. Some studies also show improvements in headaches and neurological function. Future research for treating Melas heavily focuses on the use of gene therapy to remove or replace disease-causing genes in the mitochondrial DNA using a modified vector such as a virus. An exciting area within this field of research includes in utero fetal gene therapy. This therapy can act as an early intervention where therapeutic genes can be delivered to impacted cells and tissues early in prenatal development. These genes could correct for the disease before damage occurs. Because Melas affects individuals differently, gene therapy approaches to treatment in the future could allow for more highly personalized treatment plans to be developed which are tailored to each patient's unique genetic makeup. While there is still much we do not know about Melas and its underlying mechanisms, the advances currently occurring in genetics, imaging techniques and investigations into mitochondrial biology are helping to rapidly increase our understanding of the disease. Through further research, scientists and practitioners can identify more biomarkers, develop better diagnostic tools, as well as explore novel therapies. These could help improve patient survival and quality of life.